Hello, welcome to Boston Bone and Joint Institute. If you're watching this video, you may have a few questions about your Darco toe alignment splint. This is the toe alignment splint by Darco. Unfortunately, many insurance companies do not cover this item, and there may be out-of-pocket costs involved. Boston Bone and Joint Institute collects payment for this splint. Please contact our office for additional information on how to obtain one. The purpose of this splint is to protect your toe while you recover from toe alignment corrective surgery, most commonly from bunion or hammer toe procedures. This splint has the ability to protect your alignment through stretching of the surrounding soft tissue through a gentle pulling of elastic straps. You'll be provided a protocol that will detail the instructions as to when the splint may be removed. Please refer to your protocol for the length of use and any additional restrictions. The Darco toe alignment splint is a one-size-fits-all design and universal for the right and left foot. The elastic straps will facilitate which direction your provider wishes to maintain your corrective alignment, customizing this splint to fit your need. To apply the splint, first, secure the metatarsal elastic band around the arch of your midfoot. Next, fasten the elastic heel strap around the heel and secure the Velcro on both ends to the metatarsal elastic band. Depending on your specific need, next, apply the loops for your great toe and lesser toes, as shown by your provider. Commonly, for bunion procedures, your greater toe loop should be applied as shown here. Commonly, for hammer toe procedures, your lesser toe loops should be applied as shown here. The loop should be applied to the surgically corrected toe or toes. Unfortunately, the elastic band must be tight, and toe loops must be secure to ensure the splint does not slide on your foot. The splint should not cause significant pain. If you experience tingling or changing color of your toes rather quickly after applying your Darco splint, one or more of the straps may be too tight. To fix this, unfasten and refasten the Velcro of either the metatarsal elastic band around the arch of your foot or attachment of the greater or lesser toe loops. Any adjustments other than the tightness or looseness of the elastic band or loops should be communicated with your provider prior to doing so. Typically, the toe alignment splint is worn for 6 to 8 weeks post-operatively. However, daily use as well as the duration of time may be more or less dependent on your specific surgical procedure performed. Often, the toe alignment splint is worn in conjunction with a pneumatic walking boot or post-operative shoe. Your weight-bearing status in either the walking boot or shoe will also be at the direction of your provider and dependent on your specific surgical procedure performed. Please refer to your post-operative protocol for further details about length of use and additional restrictions. To clean your toe alignment splint, it is best to hand wash with soap and water. At any point, if your splint becomes soiled or worn, please contact our office for information on how to obtain a new splint. We find many patients prefer to have a few splints to rotate for sanitary reasons. If you have additional questions regarding your toe alignment splint, please refer to your post-operative protocol, discuss with your physical therapist, or contact our office by phone or message through the BSSC portal to speak to a certified athletic trainer.